Signs you are actually depressed, not lazy. Sometimes you may not be lazy. Instead, you may be depressed but unaware of it. Here are several signs that your failure to reach your goals may not be due to laziness but rather a depression. If any of these relate to you, get help from a professional who can diagnose and treat your depression so you can rebuild your life. Realizing that you can't encourage yourself. Having motivation may be a tough process. You may wake up on some days with the energy to approach your goals, while on other days, you may find it difficult to get out of bed. It may be time to reconsider whether your low energy levels are the result of laziness or depression if you frequently find yourself finding reasons not to start something new. There are differences between these two states of mind, so if you believe that depression may be a factor in your situation, speak with a therapist about treatment options. Just be aware that it might not be laziness talking after all if someone starts talking about mental space and asks if you get enough sleep. Lack of motivation affects all aspects of your life. You barely put enough effort into your career to get by, don't care to clean up after yourself or take care of yourself at home, and don't even bother getting dressed for work. Being depressed can also impact your sleep habits. Most depressed people have difficulty falling asleep or staying awake at night. Due to all these symptoms, you find it more difficult to leave your home and go out into the world. Although those symptoms may appear to be due to laziness, depression is actually to blame, and sometimes it can be difficult to differentiate between the two. You can use a simple test to determine whether you should consult a doctor for depression. Your depression is getting worsened by a physical condition. Having a medical problem can make it challenging to stay employed. Additionally, depression may make you less focused on your work. Both conditions need medical attention and can make one another worse. Consult your doctor immediately if you are experiencing any chronic health problems that were either newly diagnosed or are getting worse. Make sure you are fully aware of your medications, especially if they are new, and how they might mix with other medications or routine activities. Never be afraid to ask about potential side effects because no drug is ever guaranteed to be 100% safe for everyone who takes it. No one size fits everyone. What functions for one individual may not function for another. Something recently occurred that made your symptoms worse. This isn't a requirement to have depression. Some people's symptoms haven't changed, and they are still experiencing them. However, for some people, there is always something that seems to worsen depression symptoms, and we frequently blame ourselves for lacking the drive or motivation to solve it. Maybe you had a breaking out with a close friend, lost your job, or got divorced. You likely had no control over whatever occurred, which can make you feel like giving up on life because bad things keep happening. The good news is that realizing you aren't lazy helps you fight self-blame, making it easier for you to get through difficult situations. Life seems meaningless. Depression is characterized by helplessness and the sense that life is meaningless or without meaning. Numerous additional mental health problems, such as low self-esteem and suicidal thoughts, might result from it. Lack of energy, chronic fatigue syndrome or depression may be responsible for a continuous lack of energy. Additionally, depression can make it challenging to focus on one item for a long time. Loss of enthusiasm for hobbies, even though they aren't physically demanding. If you find yourself avoiding activities you once enjoyed because they feel like too much work, such as folding laundry, it may be an indication that you are depressed. Your depression is impacting other factors of your health. One of the many indications that you may have depression is poor health. It's also possible that your sadness impacts your connections with family and friends and other aspects of your life. It could signify that something is wrong if your loved ones notice minor changes in your behavior or mood, including changes in what you talk about and how you act. Don't ignore it if you suspect depression is the cause. Millions of individuals experience depression each year. For some, it can become so severe that considering suicide becomes an option. You can get some of those sentiments off your chest and into the open, where they can be dealt with properly by talking to someone about how you're feeling. Being depressed results in low self-esteem. One of the numerous signs of depression is low self-esteem. It can be difficult to wake up and go to work if you have low self-esteem and a negative perception of yourself. Additionally, it may seem too difficult to put in a full day's work at your job if you lack confidence due to depression, which may make you feel even more depressed and unmotivated overall. You might find it useful to think about receiving therapy for your depression to regain your self-confidence and begin enjoying life once again. When there is no longer any enjoyment. Many people mistake this sign of depression for laziness. Even small pleasures like seeing a friend or eating feel difficult and expensive when we're unhappy. It would be best if you didn't ignore the basic indicator of sadness, which is feeling unmotivated or sluggish. Consult your doctor about whether you're feeling depressed rather than lazy if you feel like your regular routines are stressing you out more than usual, and you don't want to be around others you like being with. People commonly claim that those who are depressed are probably lazy or unmotivated. It is not true that being depressed causes you to be a procrastinator or a couch potato, even if numerous factors can cause depression. It is possible sometimes to be both lazy or unmotivated and depressed. The truth is that depression has a wide range of effects on people. Although there are similar signs of depression, everyone who has it will experience it differently. It can be difficult for one person to determine whether another person is sad. They might have another condition. Depression is a serious illness. Many dismiss it as just being clingy or lazy. Those who suffer from depression understand how terrible it can be. Those who don't suffer from depression may find it difficult to understand why someone would give up or pass up possibilities. But those dealing with depression are more aware than anyone that it's not something they want to deal with, but they also feel helpless to make a difference. It's important to understand that someone who is depressed isn't choosing to live a full life. Rather, they may not have any other option because everyday chores like getting dressed and eating become difficult and exhausting due to their altered brain function. Talk to your doctor or a mental health expert immediately or early if you think you might be depressed, and get treatment.